Welcome to Clinic Observation Emergencies. I'm Christy.
I'm Karen.
And unfortunately, we're going to read a little bit from the manual. It may be a little boring, but this is important information, all pertaining to what could happen on your clinic shift and who to contact. In a case of emergency, for instance, you're going to want to activate your emergency response since we're in a clinic, not a hospital. So you will call 911 and you want to get the supervisors involved and stabilize your patient. If there's any needles in your patient, you're going to want to remove those first. And become familiar with any signs and symptoms of what pneumothorax looks like and internal organ punctures. You'll want to remain alert for any signs of fainting in any of our patients as well. And a lot more detailed information can be found in our CNT or clean needle technique manual. One reminder, if you're burning moxa, please don't smolder it out or crush it out. Never place it directly in the trash, and all those reasons for burn safety, but then also burn safety of the next patients as they come into the clinic, so no loose pieces fall on them. Karen?
Okay, I'm going to talk a little bit about accidental needle stick exposure. Pacific College is not aware of any documented cases where a person has contracted hepatitis B, hepatitis C, or HIV through accidental acupuncture needle sticks. So as reported by the Centers for Disease Control and Prevention, the greatest risk of blood-borne pathogen transmission through needle stick exposures actually is encountered when the needle in question is one of these four things. If the needle is large, hollow, and of a thick gauge, such as an IV needle or a hypodermic needle that's used in an artery or vein, if the person is visibly bloody, if it's implicated in a deep intramuscular puncture or implicated in having been used on a known HIV, HBV, or HCV positive source patient. So although the risk of transmission of blood-borne pathogens through accidental acupuncture needle stick is really low, the college does take every needle stick incident very, very seriously. So each college student that is exposed to a needle stick is entitled to timely post-exposure medical evaluation through each campus's medical consultant. The college will finance the cost for the evaluation, but the college is not going to take responsibility for the cost of any treatment should it be necessary. So you're going to be responsible for that cost if treatment is necessary, but the evaluation is covered by the college. If a needle stick injury occurs, please follow the protocol that Christy's going to go over now.
Thanks. So, if you've been exposed to blood or any body fluids, and a needle stick would include this, you want to immediately clean and decontaminate that affected area using soap and water. You can either rinse your mouth, nose, and eyes with water and saline if that has been the area of your body exposed. And you're going to disinfect that area with betadine and or another brand of 10% providone iodine solution available at each of the designated hand washing stations in our clinic. You're going to immediately call the number listed in your particular clinic for the medical follow-up and consultation, and that's here. Instead of putting down the address or anything for everyone, it would just be to commit to memory that it's Northwestern Memorial Hospital. If you want to put that phone number under like a little tag instead of ICE, but put clinic, and then that might be nice to have on hand. You'll be very usable in that activating the emergency response system then as a person. But and then you just want to make sure that you contact Lynn, make sure she knows, and that any of the supervisors on staff also know. So what has happened to you that day, and there'll be a form that you'll fill out, and that needs to get done within 24 hours.
Okay, so let's go over other blood-borne pathogen exposure. So needle stick exposure is not the only way that blood-borne pathogens that we can be exposed to blood-borne pathogens. It's important to note that the college employees and the students may also be exposed through contact with blood and body fluids that are unrelated to direct practice of needling or contact with an acupuncture needle. For example, if a patient vomits or spits in an employee's eyes, exposure to blood-borne pathogens must be considered. And the same protocol that was discussed earlier should be followed. Skin exposures or cutaneous exposures to blood and body fluids with intact skin, though, are generally considered to be low risk. The CDC identifies the following as risk factors in mucosal or integrity compromised skin exposures to blood or body fluids. So one is exposure to a large volume of blood and body fluids, and the second one is prolonged exposure to blood and body fluids. Blood and body fluid exposure can be a stressful and disruptive event, and information about some of the risk factors associated with blood exposure to blood-borne pathogens is offered to provide some general information to the college community in order to establish a cautious, rational, and professional approach to exposures. So the hope is that this can put the risk of exposure in perspective for everybody. Christy's going to go over
burns. I'm burning. If a burn were to occur during the treatment, and typically what we want to look at, and I'll reference our teammates from earlier that did the cleanliness of the premises in our clinic manual. When you're cleaning out those rooms, you also want to check all the equipment, and that TDP lamp is the heat lamp. Look to make sure all the screws are connected, and you never want to place that lamp too close to a body skin surface when using it. But should a burn occur, you would, whether it's from Moxa, that heat pack, the heat lamp I just mentioned, and or a chemical burn, make sure that you're immediately running cool water over the burn. Never use ice. You can use the burn ointment if you'd like. However, you should definitely apply a sterile gauze secured by medical tape to the skin. And if it's a severe burn, 2nd to 3rd degree, or if it's covering a large surface of your body, then you should definitely go to the emergency room immediately. And now more on the need for expert medical evaluation.
Yep, so all of the things that we're going over should not and cannot replace the advice of biomedical clinicians with expertise in post-exposure prophylaxis and treatment. The expert clinicians at Pacific College's medical consulting group sites listed in the section that we talked about earlier, they're uniquely qualified to assess the relative risk of an individual's exposure incident. So they're going to provide education and resources to the affected student. This may include evaluating the risk of HIV, hepatitis, and B and C, specific to the exposure, and directing the affected student to HIV testing, presenting prophylactic treatment options, and providing counseling. Any employee for whom the HBV vaccine is recommended because of potential for occupational exposure to HBV while employed at Pacific College must sign the vaccination refusal statement if the employee refuses the vaccine. There's more information regarding this needle stick protocol, and it's available on the internet at this website up here, www.mpaetc.org. You can check them out for more information. And then lastly, we want to talk about the emergency action plans. And so each campus has an emergency action plan that outlines the policies and procedures regarding various emergencies, including medical emergencies, environmental emergencies, and evacuations. Now, on evacuations, if the building has to be evacuated, you want to make sure you don't try to take anything with you.
Not even your phone.
Right, not even your phone, not even your banana. If you have a banana or a lunch or whatever, just leave it here. It'll be here when you get back.
You're going to hear a lot about this banana. Buy that banana at 7-Eleven across the street from the Rally Point.
Banana stories, so don't forget. Just remember, don't take anything with you. If you got to get out of the building, just go. And that is the end of our presentation. If you have any questions or you need more information